Assalamu alaikum. My name is Ashmi and I have been given these two ayats from Surah Kahf for their tafsir. The tafsir of ayat number 47 highlights several key points. On the day of judgment, Allah will cause the mountains to crumble and disintegrate. As a result of the mountains being destroyed, the earth will be laid bare with its features and structures exposed. Allah will gather all of humanity from every corner of earth. This includes both the righteous and the sinful. The verse concludes by stating that Allah will not leave behind a single individual. This means that every person without exception will be brought before Allah for judgment. The tafsir of ayat number 48 highlights the following points. On the day of judgment, all human beings will be presented before their Lord in rows, indicating the grand gathering and the accountability of each individual. Allah reminds humanity that they have come to Him in a manner similar to their original creation. The verse also alludes to the false claims made by people during their worldly lives. Many individuals deny or doubt the appointment of a day of judgment or a divine appointment by Allah. They falsely believe that there will be no accountability for their actions and that they will not be held responsible for their deeds. इसके बाद मुझे ये हदीस दी गई है, वज़ू जन्नत के सारे दरवाजे की कुंजी है। इसका मैं तर्जुमा रीड करूंगी। इसका तर्जुमा ये है कि हजरत उमर बिन खत्ताब रज़ियल्लाहु अन्हु से रिवायत है कि रसूलुल्लाह सल्लल्लाहु अलैहि वसल्लम ने एक सिलसिला कलाम में फरमाया, जो कोई तुम में से वज़ू करे और पूरे अदाब के साथ खूब अच्छी तरह और मुकम्मल वज़ू करे, फिर वज़ू के बाद कहे अशहदु अल्ला इलाहा इल्लल्लाहु व अन्ना मुहम्मदन अब्दुहु व रसूलुहु, तो लाज़मी तौर पर इसके जन्नत के 8 दरवाजे खुल जाएंगे। वो जो दरवाजे से भी चाहेगा जन्नत में जा सकेगा। Now moving towards our topic, which is lipoma. What are the points of recognition of lipoma? Lipomas often have a distinct feel when touched. They are typically soft to the touch with a rubbery consistency. Lipomas can usually be moved around under the skin. They are not fixed or attached to deeper tissues or structures. Lipomas are usually found just below the skin, commonly on the torso, neck, upper arms, thighs, or in other areas with a higher concentration of scalp cells. Lipomas tend to grow slowly over time, often taking months or years to become noticeable. Lipomas are usually painless, but they can cause discomfort if they press on nerves or other structures. Lipomas typically have a rounded or oval shape. Lipomas can range in size from very small pea-sized lumps to larger masses several centimeters in diameter. Now, what are the causes of lipoma? Lipoma is not fully understood. The causes of lipoma is not fully understood, but it can caused by physical trauma, genetics, obesity, diabetes mellitus, high cholesterol. There are certain conditions which can cause lipoma, and these conditions include Dercum's disease, Gardner syndrome, hereditary multiple lipomatosis, Madelung's disease. Dercum's disease causes painful lipomas, and it is typically on the trunk, arms and leg. This is also called adiposis dolorosa or Anders syndrome. Gardner's disease is a type of issue called familial adenomatous polyposis (FAP). It causes lipoma and a scope of medical conditions. Hereditary multiple lipomatosis, also known as familial multiple lipomatosis, is passed down through family, so it is genetically passed. Madelung's disease is caused in men who consume excessive amounts of alcohol, and this may cause lipomatosis. Now, how can we diagnose a lipoma? Physical examination is done. A healthcare professional will examine the area of concern by palpating and visually inspecting the lump. They will assess the size, texture, mobility, and other characteristics that can help determine if it is likely to be a lipoma. Your doctor may ask your questions about the lump, such as when you first noted it, whether it has changed its size or appearance. Imaging tests can be done, such as ultrasound, MRI, and CT scan to check whether it is fatal or not. In certain situations where there is diagnostic uncertainty or suspicion of an atypical or unusual growth, a biopsy may be performed. During a biopsy, a small sample of tissue is extracted from the lump and sent to a laboratory for microscopic examination. This can help confirm the diagnosis and rule out the other conditions. What are the types of lipoma? There are several types of lipoma including angiolipoma, conventional lipoma, fibrolipoma, hypernoma, myelolipoma, cellular spindle lipoma and pleomorphic lipoma. वैसे तो हर लाइपोमा जो है वो फैट का बना हुआ होता है, बट एंजियोलाइपोमा also contains blood vessels with fat. Conventional lipoma is only made up of white fat cells and energy is stored in these white cells. Fibrolipoma is made up of fat cells and fibrous tissues. Hypernoma is made up of brown fats and heat is produced and body temperature is regulated by these brown fat cells. Myelolipoma is made up of tissues that make blood cells and fats. Cellular spindle lipoma is made up of cells that are longer than they are wide. Pleomorphic lipoma is made up of cells that range in size and shapes. Lastly, let us talk about the prevention and treatment of lipoma. Unfortunately, there are no specific measures known to prevent the development of lipomas. Since the exact cause of lipomas is not well understood, it is challenging to provide preventive strategies. In many cases, lipomas do not require treatment unless they cause discomfort, affect mobility, or are cosmetically bothersome. Lipomas are typically benign and harmless. However, if treatment is desired or necessary, the following options may be considered. First, observation is done. Then, the most common treatment for lipomas is surgical excision. This procedure involves making an incision over the lipoma, removing the fatty tissue and closing the incision with sutures. Surgical removal is typically performed under local anesthesia and recovery is usually quick with minimal scarring. Liposuction may be an option for certain types of lipomas. This technique involves using a thin tube to suction out the fatty tissue. Liposuction is generally considered for larger lipomas or when multiple lipomas are present in one area. Thank you so much.